can also be mentor. Okay? So keep in mind you should have only one guide and one student. No guide can take more than one student, and no student can take reference of more than one guide. Is it okay with that question? Next.
So
So
the
can clinical trials
so the
yes.
next question is, can clinical trials or in vitro studies can be done?
I said I'll repeat once again. Clinical trials are not done according to ICMR because trials meaning only it requires more than minimum 1 year duration of time, and that much time is not given for STS projects. And in vitro studies, of course, in vitro studies are accepted nowadays. The new generation are doing more on molecular studies, but it should be cross-sectional study. It should not be cohort or trial. Okay, in vitro studies are accepted, but of short sample size and less duration. But why I suggest you not to go for in vitro studies is they require more funding. Means in vitro studies having a investigation will require more cost, and you people will be getting stipend of around only 50,000. In vitro studies are more than that, I believe, and the facilities. In if your department or if your things in your college in vitro studies are established, then it is feasible. But you should also think about the cost effective. ICMR researchers can think in the way that an undergraduate level, this much within the amount of 50,000, is the study affordable to him or not? In that way, they think. The next question, Anisha. I hope that is answered.
Uh, so the next question is, can we conduct survey studies with questionnaires?
Of course, why not?
So
Those are accepted easily.
it's a 50,000, but like stipend also. So most of the students are asking, it's a 50,000. Will the ICMR accept if it's just a survey study?
Yeah, that is a good question you have asked. It doesn't matter on the this one that 50,000 actually is a reward for you. Actually, you are not supposed to use it for research. It actually is a reward given by the ICMR people. But what happens? Actually, in the ICMR, it is written clear cut that the cost of the research should be borne by the respective institutions. If at all the respective institutions managements are not giving you fund, then you have to utilize that fund given by the ICMR. And that too, it will not come initially. It will come after approval of your report. Okay, that in that sense, I am telling about that. As the question was, original question was why the observational studies get easily accepted even they are of less cost. The idea is you are at the undergraduate level, and questionnaire study should be in a such a way that the implication coming of that research questionnaire study should be effective to the communication. Okay, for example, take for vaccination for dengue. Vaccination of dengue still has not yet come. It is under trial, but many are not aware of the vaccination of dengue. You can make a set of questions, make a pilot study, and make a study among yourself, students, that how does the knowledge, attitude, and practice of the dengue vaccination among the medical students or BDS students. So in that way, it will get accepted. I hope that is answered. If further query is required for that.
No, sir. So the next question is, can we do survey or investigation in using patients?
Yes, of course. According to your BDS practice, also you can use your dental patients. The survey is a qualitative study, and the investigation parameters will be quantitative study. Both can be combined in a study.
Okay, sir. So, sir, we have to take a consent form and get it signed, and then we can do the actual research. I mean, ask the questions and all from them, right?
Uh, Yeah, that is after the now still it is a synopsis. Abstract is you are writing all in future tense. You will be writing in the abstract or synopsis that you are going to take consent, written informed consent in their native language. Okay. Once if it's your synopsis gets selected, then after that you should do implement it with the approval of the ethics committee of your college and with the approval of your principal. You have to take signature of the patients or subjects, and then you have to proceed.
Okay, sir. So the next question is how many specifications, like how many reference articles we need to mention in the abstract? Does it have to be 20 or 15, or it can be more than that or less than that? Will it cause any issue?
No issue. They have mentioned a particular words in the reference also, 300 words, I believe. In that 300 words, if it comes to around 10, around 5 to around 8 to 10 references, that will work out. If there are more than that, also it is acceptable, but they have made a limited word count even in references.
Okay, sir.
According to that, you can decide.
Sir, sir, in our abstract, can we mention the college name? Like we'll be conducting this study in a private medical college such as Haryana.
Yes, yes,
So can we
yes, yes.
mention that?
You can mention the name of the state, just medical college present in this state, but don't tell the college location and everything. Okay?
Okay, sir. Uh, so someone is asking what is case study form?
Huh. Case study form means it is a type of analytical study where there are two parameters, cases and controls. Okay, cases means, for example, take diabetes patients. Controls means those who are not having diabetes, they are healthy people. Okay, so among these two population we are doing a study. So what is the glucose level in diabetes compared to controls? And cases can be 50 and controls can be 50. Both should be equal. So this type of study is called as comparative study or case control studies. Okay?
Okay, sir.
I
So
hope that is answer.
one more student is asking, can the questionnaire study be accepted by ICMR? I think the question has been repeated.
Yes, yes, yes.
Uh, one more student, there's a server error in the site. Because of this, I'm not able to submit the form. So what should I do, sir? Uh,
They have given the contact number in the ICMR website related to the server submission and all. Okay. But now I want to tell you the registration is already deadline is finished. Okay, the registration for the ICMR STC 2022 has already been finished. I think it was 11th February. Now only those students who got registered they have to send their abstracts. For that it is 21st February is the last date of submission.
yes, sir.
Is that clear?
Yes, sir. Thank you, sir. Sir, student Anusha is saying, is there any possible way to collect data other than forming a questionnaire?
Is there any other way to collect the data
Other than
apart from
forming a questionnaire?
other than questionnaire means it will be the quantitative data only. If you want a numerical value results, then you have to do investigations. If you don't want to do investigations, just the observational study. Observational study. Do you know about the dengue vaccine? Answer will be yes or no. Okay. Do you know when does the dengue vaccine should be given in what age? That will be in a collective manner, quantitative manner. So that will be in a number wise at the age of 8 years, 10 years, or 15 years. Okay. So in this way, the qualitative studies can be having a empirical data, having a qualitative answer yes or no, or having a numerical value also. I hope it is answer or
Yes,
any
sir.
further query.
Uh, Anusha, if you have a further doubt, dear, just drop a message in the chat box. So Karthik Bhaskaran is asking if we can, if you're doing a product study, should the brand name be revealed in the abstract? Company.
Products with the company name.
Yes, sir.
So you are using any, for example, ELISA kit. Okay. For example, you are using the ELISA kit. There are so many numerous companies producing the ELISA kits. So you need to, every kit will be having a product name and catalog number. That should be written in brackets. That should be written, preferably.
So Bhakti Porwal is asking, can a dental related study and observation study be useful to patients but not related to medical gets approved or given priority?
They are given priorities. Okay. Dental students with the dental related subjects are given priorities. Apart from medical field, you need not go for medical field subjects. You can be having a effect of tobacco chewing on the dental caries. This is already an established fact. But try to find the limitations of these studies already done. That can be a new study for you.
Yes, sir. Uh, Sir, Namrata Manganti is asking, do we have to add consent or confidentiality letter in the methodology?
May or may not in ICMR. It can be given after the synopsis after submission also.
Okay, sir. So in the methodology, they can just mention as a line that the patient will be given a consent form before doing asking them a question.
Yes,
Or
yes,
so,
yes.
sir, is it
Simple
better
sentence
to
should be
mention,
added.
right? It's better to mention, sir.
We have to mention the word that a written informed consent will be taken from the patients. That has to be mentioned compulsory. But I am telling you about the consent form. The
Okay,
consent form what you have prepared that may or may not can be presented as a additional document.
okay, sir. Sir, Aisha Thamima is asking, if we're conducting a survey using a questionnaire, should we submit the questionnaire while submitting the proposal form?
Yes. Questionnaire studies require the submission of questionnaire because again in questionnaire there are two types of questions: non-validated questions and validated questions. What you mean by this validation means the questions are accepted according to the medical textbooks or according to certain subject expert. Those are validated questions. They are already prepared, already studies have been done on them. Those questions only are using for your research projects. Those are called validated questions. The questions which are not validated, that is your own questions, and they are not present in any textbook or not has been granted permission from the subject expert, that also can be involved in the study, but it should be a pilot study of short samples.
Okay, sir. Sir, I think when I was applying for the ICMR, there was like separate columns where it was like if you have a document like confidentiality letter, link this. If you have a questionnaire paper, link this. Attestation form, link this. So I think
Additional
that
documents.
option, that column option will be definitely provided when we are submitting the synopsis, sir.
Yes, they are separately present in that website.
Yes.
We
So
have to pick it and submit the additional documents.
yes, sir. So, Aisha, I hope that your doubt is clear, dear, because there will be additional columns given and you have to attach the document. So, the questionnaire, which is like the document consisting of your questions. Uh, Sir, Swastik Dugar has asking, can you please explain different types of studies in brief?
Different types of studies. One is mainly two types of studies. One is descriptive study and analytical studies. Okay. Descriptive studies are qualitative studies. They are also called qualitative studies. They are also called observational studies. Why? Because we are just observing the study with the help of your framing questions. Okay, and those are called qualitative studies. Next is analytical studies. Analytical means you are doing analysis with the help of investigation parameters. So blood glucose levels, blood urea level having a numerical value, and it can be invasive and non-invasive tests. Non-invasive like PFT, pulmonary function test. Okay. So again, in analytical studies, there are separate types. That is case control studies, retrospective studies, and cohort studies, and randomized control trials. So among these four, randomized control trials and cohort studies will not be accepted in ICM. Which are left now? These are case control studies and correlation studies. What do you mean by case control study? I explained already. Another is correlational studies. Correlational means you are finding an association between the two parameters, like association of increase in the body weight in terms of BMI will also increases the blood glucose levels. So when the body weight increases, blood glucose levels also increases. So these are called association studies. These are brief studies which can be done by the level of undergraduates.
Okay, sir. Thank you, sir. So one of the student is asking if previously any conducted case control study or investigation like research has been done. So can we re-research it? Can we do it again in the college in the same manner without any changes? The same thing is happening. Same thing we're doing it again.
Those are called as retrospective studies. Okay, I forgot to tell about this. Retrospective studies means already you have the patient's data in your college diaries. Okay, take all those college data and you frame a questions and try to find the association or case control studies in them. You can go for it.
Okay, sir. Uh, so, uh, so like if it is not a existing data, but the research has been done in some other part of the country, so can we do the
Mhm.
same research again in our college?
Acha. Okay. So that has not been done in our country. That same
Yeah,
research.
like somewhere like in the North India or somewhere in the South India, some other state.
Okay.
So
Okay.
can the
Fine.
same research be done in our
I'll,
college?
I'll tell in two scenarios. Okay. One scenario is the study has been done in foreign countries and it has not at all done in India. So that will gain some weightage, telling that this this type of study has got this type of result and in that area, and there are specific factors affecting in that region. So I am going to assess the same parameters to see the effect of influence of the region or environment in this area. So in that scenario, you can do that study. Next scenario, the same studies have been done in foreign countries also and in the in our countries also. Same parameters and same region. And for these type of studies, again, if you repeat it, the chances of rejection will be more because you're not trying to find any new thing in that, new parameter or any new knowledge gap in this.
Okay, sir. So there are so Tejosmita Chowdhury is asking, are comparative studies acceptable?
Of course, why not? Comparative studies between the one disease with the other who is a not disease, or comparing the effect of one intervention. Proposed intervention means I am introducing one technique called yoga methods or some new information of your technique in dental technique. Okay, so comparison of this new technique before the application and after the application. Those are also comparative studies.
Yes, sir. Okay, sir. Sir, Namrata is asking what we have to write in confidentiality.
Confidentiality, there is a separate form is given in the that as you said in the additional document that is related to the consent process. You are going to maintain the written informed consent in the own language of the patient and getting their signature. If the samples is a child, then you have to take the consent of their parents. These things should be mentioned in the confidential, and also your reports and this thing should be added to the college management only. You should not publish these results or give for publication to other colleges. That is the confidentiality of the scientific committee.
Okay. Swastik is asking if we can do studies to assess the temporal relationships of the diseases.
Yeah, that is also can be done.
Okay,
Causal association, temporal association can be done.
okay, sir. Sir, Tejusmita is asking, to be more precise, can we do comparative studies based on two different instruments that are acceptable mostly in dentistry?
Yes, two similar uh, or different.
Sir, sir, different, sir.
Uh, Two different instruments. So you can do like plan it like this. Uh, the efficacy of these two instruments in applying for this disease. Okay, like that you can compare.
Okay, sir.
Which one will have giving more effective results?
Okay, sir. So Sahiti is asking, do we have to mention materials separately before methodology?
No, materials and methods comes in methodology section.
Okay. So Tejal is asking, sir, can you recommend any questionnaire studies related to COVID and its aspects?
I suggest all of you don't do any COVID related studies because already there are millions of papers in the published data, and ICMR's research scientists will think that you are at the undergraduate level, and they don't want you to again expose for the COVID. That's the one. And the other reason is already now the third wave is also has gone. In future, whatever fourth and fifth wave is coming, they will be having short sample size. And I suggest you people don't take any COVID related studies.
Okay. Bhakti, actually, previously the session has been explained here regarding the format and the points to be mentioned in the synopsis. Uh, like, I'll try to post it on the YouTube channel so you can check it out there. So the student is asking if you can like repeat the format again.
Okay, in a nutshell, now
Yes,
again,
sir.
so the format of abstract should be have a reference number that is generated and given by the ICMR people. Next will be the title. Title should be short, brief, and concise. Okay. And the next will be the after title, it will be introduction. You have to introduce the importance of the research study you are going to do. You have to describe about the rationale behind why you are selecting this study. And you have to tell what new thing you are going to find in this study compared to the previous studies. And also you should briefly mention about the methodologies used in the different studies. That's why I am going to take these studies. Next will be the objectives. Objectives should be written in a tabular column. Minimum 1 to 3 objectives should be written, and certain verbs you have to use to assess, to explore. That you have to discuss with your guide. And after objectives comes what methodology. In methodology is a core section part where you have to describe the samples. What is the sample size? What is the sample population? And what is the type of the study? What are the statistical methods you are using? And all those additional documents, consent form, confidentiality, proposed intervention, and all these institutional ethical clearance will be taken before the study is started. This all should be written. And all the sentences should be written in future tense. Don't write in present tense and past tense. Okay? And references should be given here by writing a superscript on the end of the statement. If you don't write superscript, then the references, whatever you're writing at the last, they research scientists will consider that they are fake. The high chances of a rejection will be there if you don't write superscripts. Then after the methodology, write expected outcome. This is also called implications. So I am after doing this research study, I am going to get the results like this. I am expecting the results like this. And what benefit of these results will be having on my patient or on the academics or onto the community? That you have to stress in the expected outcome. And at last, you have to write references in the Vancouver style, and references should not be old more than past 10 years. I
Okay.
hope I told in a
Yes,
nutshell.
sir. Yes, sir. Thank you, sir. Uh, so Shaina is I'm so sorry. So Shaina is asking, can we merge research parameters related to the same topic from different articles as your synopsis?
Then it will be once again. Can you repeat the question?
So can we merge research parameters related to the same topic from different articles as synopsis, as a research synopsis?
Then what new thing will be done? Merging means you're copying the parameters of all the different studies and making your own, telling that that study is new one. So entirely it will be the material of the different literatures. No? There will be high chances of rejections.
Okay, sir. So, but I mean, previously also one student has asked, like, as research has been done in another part of the country, like somewhere else. So, can I do the same research again in my college? So that means the
Now
parameters copied, sir.
you have to stress here the importance of the study here now. Since these studies have been done in the that area, that is in the different country, I am since these type of studies have not done in these areas having these influencing factors, so this study will help in determining the effect of environmental factors on these type of studies. Like that, you have to create a knowledge gap, then only the study will be accepted.
Okay, sir. So Tejasmita is asking, so how do we need to like calculate the number of participants or the patients to be considered for your study? Do we have to like 25 people or 100 people? How to like calculate that?
There are two types of studies. One is short studies and larger studies. Short studies are called as pilot studies. For pilot studies, the number of participants should range between 15 to 30. That is fixed, not more than 30. For larger studies, you need the help of statistician and take the help of a statistician with the help of your guide. He will give you some work. He will ask you to find the prevalence and the number of samples in the previous literatures, which is the more similar to your literature. Based on that, you are doing the studies. Based on the sample size and prevalence of the previous studies, he will calculate and give you the participants sample size. But if that comes around more than 200, then it will be difficult for you to conduct. You can tell that by sample size calculation, the sample size is 200, but because of the time duration limit and because of inclusion and exclusion criteria, I am taking convenient sampling of the sample of size 100. Like that, you can mention and proceed.
Okay, sir. Uh, so that's all, sir. Only these questions have been asked.
Okay, then I hope all of you to become best students. And the best is the person who is a student who invented the insulin. So I want all of you to give more benefit to the community in your dental field. Okay. Thank you very much. Good night, all of you.
Thank you, sir. Sir, we are so grateful to have you in this platform. I mean, thank you so much for saying yes for this, because I called you all of sudden and you said yes. I didn't expect it. So I really hope that this session was like super helpful to all the dental students, because there is like many of our guides that we are finding in our colleges are not able to help as much. So after listening to this session, and like there was a 20 minutes gap, and I got a lot of messages from the students saying that this webinar was really good and helpful, and that I got more help from this webinar from rather than from my guide. So, so I'm really grateful to have you as my guide in my second year, sir. So thank you so much.
Okay. Thank you very much. Huh? Good night. Good night, all of
Yep. Thank you, sir. Good night, sir.
you. Good night.